episode 68, which is all about cluster headaches. So a bit about them. Cluster headache sufferers tend to report their pain as being the worst imaginable, and these are often considered the nastiest of the primary headache disorders. Although not a very common type of headache, approximately 1 in 1,000 people suffer from them. They are severe, and the pain is enough to make some cluster headache sufferers feel suicidal. Cluster headaches are a series of relatively short but extremely painful headaches experienced daily for weeks or months at a given time. They tend to happen at the same time each year. They're more common in men than women, with a ratio of 2 to 1, and they can disappear completely but then come back again without any warning. So what's happening when they occur? It's not understood exactly what causes them, but a nerve in your face is involved, creating an intense pain around one of your eyes, and the nerve signal seems to come from a deeper part of the brain called the hypothalamus, where the internal biological clock that controls your sleep and wake cycles lives. Attacks appear to be linked to your circadian rhythm, which is your body's internal body clock. They happen so regularly, generally at the same time each day, that they've been called the alarm clock headaches. One will often wake you up an hour or two after going to bed at night, and the attacks can be more severe at night than they are during the day. What are the symptoms? Some of the main ones are rapid pain onset reaching full force within 5 or 10 minutes. They're normally short-lived, between 15 to 90 minutes, but can sometimes last up to 3 hours. You may get 1 to 3 a day. They're always one-sided and on the same side, and they can be burning or piercing, throbbing or constant, with pain sometimes spreading to the forehead, temple, nose, cheek and upper gum on that side. Are there any warning signs? Although the pain starts suddenly, you may experience a few subtle cues, such as discomfort around the eye, which might become swollen or drooping, with a smaller pupil and sometimes redness or watering. How can it be treated? Unfortunately, there is no known cure for cluster headaches. The goal of the treatment is to decrease the pain severity, shorten the headache period, or prevent the attacks. Due to the nature of cluster headaches, fast-acting medication and breathing oxygen through a face mask for 20 minutes can help. Some drugs prescribed by your doctor can reduce the pain as well as lessen the intensity and duration of the attack, as well as be used to prevent them. In extreme cases, surgical procedures can be done to block the trigeminal or occipital nerve involved, or they may implant electrodes to interfere in the nerve transmission. Although these procedures are very rare, as they are considered to be high risk with potentially serious side effects or consequences. So what can you do? The main thing is to be aware of the possible causes or triggers which you should avoid, including cigarette smoke, alcohol, weather changes, strong smells, bright or flashing lights, and hot showers. To help you avoid it or better cope with an attack during the cluster cycle, you should stick to a regular sleep schedule, as they can begin when there are changes in your normal sleep routine. Melatonin has also been shown to provide modest effectiveness in treating the nighttime attacks. Additionally, something you may want to consider is joining a headache support group to help cope with them. And finally, have a regular massage or therapeutic treatment. Although this may not relieve or change the pattern or intensity of your cluster headaches during a headache cycle, be it weeks or months, the anxiety and stress can be severe, so massage or manual therapy may help you to relax and relieve some of the stress, allowing you to better cope with it. That's all for today. See you again next week for some more bite-sized bits to help the health flourish. Bye-bye for now.